We basically teach them to rewire the brain. So the physical problem is gone, and the fear of pain, or whatever the fear of sex or whatever needs to be removed. So for that sexual counseling and the sex therapy, and sometimes the kind of psychotherapy for childhood issues and all that in a combination will be helpful. At the same time, we give that for the male partner, so that they also learn how to kind of deal with the women. Sometimes they could be maybe a bit ignorant or whatever. And another thing is that we also give them couple therapy to make them come together. We even teach them pelvic floor exercises to open their pelvis, so that the pelvic muscles are relaxed, and then it works very well. So it's always a combination therapy. And because we find that a lot of women have PCOS, polycystic ovarian syndrome, when we do a scan under general anesthesia, we also check the hormones. So we find that many women have PCOS. So we treat PCOS simultaneously. So we give some hormones in the initial months, like a cocktail, for them to actually, have the sexual desire, and, for them to start having lubrication and that attachment. Once it's kind of corrected, they won't need any medicines. But they will need some medicines for PCOS, like, vitamin D or probiotics and insulin sensitizers for a while. And some women do have issues with infertility, so they may also need some help with ovulation medicines for the PCOS women.